Welcome back to Healthcare Hoax. I'm Janet Cimorelli. I'm here today with Dr. Herb Slavin, and we're bringing you this time all about brain, how to support your brain, how to have a healthy brain, how to get the most out of your brain. And we talked the first part of this series on brain. We talked about statistics, some of the issues that people might be dealing with, and now we're talking about causes here on Healthcare Hoax. And so what might some of the causes for memory loss, anxiety, depression, just not having optimized brain function? So one of the areas that I would pick on, unfortunately, has to do with medications. I see in counseling people, so many people who are taking cholesterol lowering drugs. And I think it's pretty well known that, okay, when you take a cholesterol lowering drug, you might be dealing with some muscle and joint pain as a side effect, but not too many people realize that using a cholesterol lowering drug, you may very well be affecting your brain. You're surely affecting your liver, you're surely affecting how fats function in your body, and don't you know that your brain is fatty tissue and relies on that proper delivery of a variety of different fatty acids in your body. Dr. Slavin, do you see very many people who might be complaining about their brain function when they're taking cholesterol lowering medication?
You're specifically talking about statin drugs.
Yes.
And I would say most of my patients, not all, but most, are not taking statin drugs. A handful are, and they've been so convinced how important that is. The best I can do with them is try to lower their dosage and then recheck their levels, to see that they're not out of control. But lots of side effects, and one of them is the memory loss that's documented with statin drugs. A recent side effect is diabetes with statin drugs. So you have to be aware that it's not a good drug to take, especially when you can lower your cholesterol just by changing your diet to adequate levels.
Have you read any of the research with regard to thoughts of suicide with cholesterol lowering drugs? And I just heard a very frightening statistic about the number of suicides every year here in the United States. And that initially, many years ago, let's say 15, 20 years ago, when certain statins were just being established in the marketplace, that it was one of the items listed in side effects was thoughts of suicide. And it's interesting. So you think about depression, you think your brain's not getting what it needs, and consequently a variety of issues like the anxiety, like the depression, like loss of concentration and memory issues. The other cause, dysbiosis. So you think about how many medications, how many prescriptions for antibiotic medications are being written every year, and the resulting digestive dysfunction associated with that use of antibiotic medication. Okay, you have some statistics for us, Dr. Slavin?
Right, I hadn't heard of that association with statin drugs and suicide.
Thoughts of suicide.
That's a common association with antidepressants.
Yes.
So that's another category of drug that creates a problem. But I want to read the common adverse reactions associated with Lipitor, and it would be the same for all the statin drugs. And the reason this is important to know, a lot of times you'll go to your physician, you're on a statin drug, you go with some of these symptoms, and instead of him attributing it to the drug you're taking, he's going to think it's a completely unrelated problem and give you another drug to treat it. Now, listen to these. upper respiratory infections, headaches.
So these are common side effects associated with the drug Lipitor.
Yeah, all right. Well, most
Published
statin
like
drugs.
in the
Sure.
PDR.
This is in the published information about the drug.
Mhm.
Arthralgias and arthritis, diarrhea, extremity pain, urinary tract infection, dyspepsia, which means basically heartburn, nausea, musculoskeletal pain, muscle spasms, myalgia, that's muscle pain, insomnia, sore throats, diabetes, abdominal pain, constipation, flatulence, asthenia, which just means a generalized malaise, urticaria, an elevated CK enzyme, creatine kinase, which is a sign of muscle damage, elevated liver enzymes, which is a sign of liver damage, a decrease in your coenzyme Q10 levels, very important if you're taking a statin drug, make sure your CoQ10 levels are above 2.
CoQ10 is going to be effective at maintaining oxygenation of your blood and tissues, keeping in mind that your brain relies on proper oxygenation. Glucose and oxygen are the fuels for your brain function.
And last but not least on these common reactions is cognitive impairment.
Wow.
So these are the common reactions. Now, the more serious reactions, tendon rupture, rhabdomyolysis, renal failure, liver toxicity, pancreatitis, some very serious skin disorders, a low platelet count, hemolytic anemia, and we said diabetes before. So when I look at these lists of side effects associated with a drug, I can't, let's say I have the list of all the dangers of the drug, and then I put it next to the benefits of the drug. To me, it's a no-brainer. Why are you using that drug? It's not worth the risk of all those side effects to lower cholesterol when all you have to do is just change your diet for the majority of people taking statin drugs.
So I mentioned with regard to causes for brain dysfunction, dysbiosis, and the use of antibiotics, keeping in mind your gut is your second brain, that there are more neurotransmitters in your gut than in your brain tissue. So you want to do everything possible to enhance the presence and function of those neurotransmitters. Then we talk a little bit about nutrient deficiencies. Dr. Slavin mentioned B12 deficiency, that it is very often an overlooked aspect of when someone is losing concentration ability, losing recent memory and recall. B12 deficiency, and it is not sufficient just to take a B complex vitamin and swallow it. You can't swallow the B12. You speak to your doctor about a B12 shot. Use a lozenge, a B12 lozenge that melts on your tongue. Don't swallow your B12. Then omega-3 fatty acids. You need fish oil. You need omega-3s. That is one of the critically important categories for maintaining brain chemistry, and of course support your antioxidant status. And then magnesium, vitamin D, selenium, iron. If you're anemic, your blood is not able to carry the minerals, not able to carry the oxygen. So those are some of the contributing factors to brain dysfunction, and you can find out lots more.
I have a few more things.
Let's do it.
Okay, and this is another, again, we alluded to this earlier about thyroid hormone deficiency. That's going to affect your mental status and your sex hormone levels. Why do you think they came up with the term, I named a movie after a grumpy old man? That was a testosterone deficiency that can create those kind of problems. And the same thing is true with women and their estrogen levels. So you have to be aware of that. But mainstream medicine is only looking to sell a drug, so they're not even testing for this. I remember asking a urologist, do you check for estrogen levels in the men you see? And he said, what for?
Wow.
That's their thinking. They may test testosterone levels. They might, for sure, they're testing PSA levels. But what for? For estrogen. Well, the point is, as men get older, they start converting more testosterone to estrogen. And you have to be aware of that and correct that, because it is, getting into more detail about different areas that we'll probably do other programs on. Hormonally reactive tissue in men and women are the prostate and the breast tissue respectively. And they're the same embryologically, and they both respond to estrogen. So that may be the reason we see prostate problems in men as they get older, is because their estrogen levels are increasing, causing the prostate to grow and create symptoms. So you want to check those levels, because it's going to have other effects, like on your mental status.
So this was our recording for causes for depression, anxiety, mental dysfunction, and we hope that you subscribe to Healthcare Hoax videos and that you share the Healthcare Hoax videos and that you like our videos, and we'll be back next time with information on the right testing so that you can identify the causes for some brain dysfunction.